Bonjour tout le monde. Good morning, everyone. I would like to begin by reiterating on behalf of the Government of Canada our most sincere condolences to the family and friends of Captain Casey from the Canadian Forces Snowbirds. We also hope that Captain McDougall recovers swiftly from his injuries. All Canadians are with you. J'aimerais commencer par réitérer au nom du gouvernement du Canada nos plus sincères condoléances à la famille et aux proches de la capitaine Casey, membre des Snowbirds des Forces armées canadiennes. Nos pensées accompagnent également le capitaine McDougall, à qui nous souhaitons un prompt rétablissement. Nous sommes de tout cœur avec vous. This afternoon, we will be having an input from Dr. Tam, who is Chief Public Health Officer of Public Health Canada, Dr. Njoo, qui est l'administrateur en chef adjoint de la santé publique du gouvernement du Canada, Minister Mary Ng, Minister of Small Business, Export Promotion and International Trade, as well as Minister Anand, who is Minister of the Department of Public Services and Procurement Canada. Dr. Tam.
Hello, everyone. Good afternoon, and bonjour à toutes et à tous. As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 78,499 cases, including 5,857 deaths, with 39,498 cases, or 50%, now recovered. Labs across Canada have tested over 1,337,000 people for COVID-19 to date, with about 5% of these testing positive overall. We are now testing an average of 26,000 to 28,000 people daily, and these numbers change quickly and are updated regularly on canada.ca/coronavirus. Before I begin, I also want to offer my sincere condolences to the Canadian Forces Snowbirds team, who tragically lost one of its members, while another was seriously injured in an accident this past weekend. As they toured across Canada to lift our spirits in the face of COVID-19, we now turn our thoughts towards them with sympathy and shared sorrow. My reflection this past weekend was on the strength of unity among Canadians. Thinking about how much we've all been through this winter, I'm heartened by the resilience of Canadians as a collective. This is not to minimize what we've been through or the difficult path that still lies ahead. It is just a feeling of confidence that we've got what it takes because of the ingenuity, unity, and caring that I have witnessed. We've all been waiting to get outdoors and enjoy a bit of warmer weather, and I hope this past weekend was a chance to do that. I know it is a bittersweet opening up of our outdoor socializing spaces because we still need to practice restraint. Some areas where COVID-19 is still active need to be extra cautious, but everywhere we still have to maintain the basics of physical distancing and limiting our socializing to core bubble of contacts. The truth is, even with slow growth of the epidemic, we are not out of the woods. No country is. We know there is no certain path away from COVID-19 and that the only safe route is the one we take together, with cautious and calculated steps forward. This will be a summer of more restrained movements and virtual celebrations than we're used to. But to keep the curve down, we've got to keep our public health practices up. That is the only real certainty, and that is why we've got to hang on to this safety rope and not let go. Throughout, I have seen the sacrifices Canadians have made to protect our health system and prevent even more illnesses and tragedy from befalling us. But it is the way Canadians have done this, with collective generosity, kindness, and ingenuity, that assures me we will give what it takes and get through this together. Thank you. Merci.
Thank you, Dr. Tam. Dr. Njoo.
Merci. Bonjour. Comme d'habitude, je vais vous donner les derniers chiffres sur la COVID-19 au Canada. Il y a maintenant 78 499 cas confirmés, dont 5 857 décès et 39 498 personnes rétablies, soit 50% des cas. À ce jour, les laboratoires partout au pays ont fait une analyse des tests de dépistage de la COVID-19 de plus de 1 337 000 personnes. environ 5% d'entre elles ont obtenu un résultat positif. En moyenne, nous testons actuellement de 26 000 à 28 000 personnes par jour. Ces chiffres évoluent rapidement et sont régulièrement mis à jour sur le site canada.ca/le coronavirus. Avant de commencer, je tiens aussi à offrir mes sincères condoléances à l'équipe des Snowbirds des Forces canadiennes, dont un membre a perdu tragiquement la vie et un autre a été gravement blessé dans un accident la fin de semaine dernière. Alors qu'ils étaient en tournée dans tout le Canada pour nous remonter le moral en raison de la COVID-19, nous tournons maintenant nos pensées vers eux, leurs familles et leurs amis, en leur offrant nos condoléances et en partageant leur chagrin. Au cours de la fin de semaine qui vient de passer, j'ai grandement réfléchi à la force de l'unité des Canadiens. En pensant à tout ce que nous avons vécu cet hiver, Dr. Tam et moi nous sommes réconfortés par la résilience des Canadiens en tant que collectivité. Il ne s'agit pas de minimiser ce que nous avons vécu, ni les obstacles difficiles qui nous attendent encore, mais simplement de savoir que nous avons ce qu'il faut grâce à l'ingéniosité, à l'unité, à la bienveillance dont nous avons été témoins. Nous avons tous eu hâte de sortir et de profiter d'une température un peu plus chaude et j'espère que vous avez eu l'occasion de le faire la fin de semaine dernière. On sait que l'ouverture de nos espaces extérieurs suscite des sentiments douce amers puisque nous devons continuer de prendre nos précautions et garder 2 mètres de distance. Dans certains endroits où il y avait encore des infections actives de COVID-19, nous devons être particulièrement prudents, mais partout, nous devons continuer de pratiquer l'essentiel de l'éloignement physique et de limiter nos activités sociales à une bulle de contact. La vérité est que, même si la progression de l'épidémie ralentit, nous ne sommes pas au bout de nos peines. Aucun pays ne l'est. Nous savons qu'il n'y a pas de voie certaine pour éliminer la COVID-19 et que la seule voie sûre est celle que nous empruntons ensemble, selon une approche prudente et calculée. Ce sera un été de célébration virtuelle et de déplacements plus restreints que ce à quoi nous sommes habitués. Mais pour garder la coupe à la baisse, nous devons maintenir nos pratiques de santé publique. C'est la seule véritable certitude et c'est pourquoi nous devons nous en tenir à cet élément de sécurité et le garder bien ancré dans nos activités. Tout au long de cette période, on a pu constater les sacrifices que les Canadiens ont faits pour protéger notre système de santé et empêcher d'autres maladies et tragédies de nous toucher. Mais c'est la façon dont les Canadiens l'ont fait avec générosité, gentillesse et l'ingéniosité qui m'assure que nous ferons ce qu'il faut et que nous nous en sortirons ensemble. Merci.
Merci, Dr. Njoo. Would now like to turn to Minister Eng.
Thank you so much, Minister Duclos. Good morning. Bonjour tout le monde. I'm glad to be joining you by video conference today. This has been a very difficult few months for Canadian small business owners. To them, I want to say we're here for you and we're working hard every day to support you. Each day, from Vernon, BC to Grande Prairie, Alberta, Winnipeg to Whitby, Rimouski, Quebec to Miramichi and Halifax, small business owners, entrepreneurs, mom and pop shops, family-owned businesses have been talking to me and my team on the phone and on video conferences. Vous m'avez parlé de ce qui a fonctionné et de ce qui doit fonctionner, de ce qui doit être développé et de ce qui peut être amélioré. And throughout this crisis, we have made our programs more generous, more flexible, and more inclusive. And thank you to all of you for what you've told us. Today, once again, we are responding to the very real needs of small businesses and entrepreneurs in our country. Weeks ago, we introduced the Canada Emergency Business Account, or CEBA. It's an interest-free loan of $40,000 with up to $10,000 forgivable if you pay it back before the end of 2022. and this is available through your financial institution, whether it's a bank or credit union. To date, over 600,000 small businesses in every corner of our country are accessing this loan. But we've heard from sole proprietors and from businesses without payroll across the country that they've been left out. Aujourd'hui, nous élargissons donc le compte d'urgence pour les entreprises canadiennes pour les aider. We're announcing that this interest-free loan will be now available to sole proprietors and businesses that rely on contractors, as well as family-owned corporations that pay employees through dividends rather than through payroll. So if you're a business owner with a minimum of $20,000, if you're a business owner without a minimum of $20,000 payroll, you will qualify if you have filed a 2018 or 19 tax return, if you have non-deferrable expenses between $40,000 and $1.5 million, such as rent, utilities, insurance, and salaries expenses, and if you have a business operating account at your local bank or credit union. While this expansion will help thousands more businesses to access this support, we know that there are still some business owners who operate out of their personal bank account as opposed to a business account, or they are new, or they have yet to file a tax return. We're working hard to develop solutions to help these businesses through this challenging time. Our work is far from done, and we will have more to say about that soon. Nous avons dit dès le début que dans cette situation sans précédent, nous serions un gouvernement qui écoute et qui s'adapte. And that's what we've done. Business owners, we're going to continue to listen to you. We're going to continue to respond to your needs. And I want you to know that we will continue to have your back. Merci beaucoup. Thank you.
Thank you, Minister. And Minister Anand?
Thank you, Jean-Yves. Today, like everyone in our country, my thoughts are with the family and friends of Captain Jennifer Casey, as well as those in my birth province of Nova Scotia. We together mourn an incredible person and a terrible loss. I thank all members of our armed forces for the tremendous work that they do every day, from serving in conflict zones to helping our seniors, to lifting the spirits of communities across this country during this crisis. You put duty and country ahead of self every day. Our country is grateful to you and proud of you. I turn now to our procurement update. Pendant que les Canadiens et les Canadiennes font tout ce qu'ils peuvent pour freiner la propagation de la COVID-19, nous continuons de nous employer activement à acheter l'équipement et les fournitures dont le Canada a tant besoin pour faire face à la pandémie. Even as Canadians return to work, with parts of the economy beginning to restart, our strategy remains constant: to continue buying proactively in a highly competitive market. As I have said in the beginning, it is impossible to eliminate all risk when securing equipment quickly in a fiercely competitive global environment. But we are taking no chances to ensure the safety and effectiveness of the equipment before it is sent to provinces and territories for use by frontline healthcare workers. Malgré les défis qui posent des chaînes d'approvisionnement internationales très complexes, nous faisons des progrès. We have now had 34 plane loads of PPE arrive in Canada. In the past week alone, at 4.8 million, we have almost doubled the number of face shields delivered. At 69.5 million, we more than doubled the number of surgical masks delivered, and we brought in more than 15,000 liters of hand sanitizer, with the total at 87,000 liters. Nous avons également reçu une commande importante de 203 respirateurs de Zoll ventilateurs en provenance des États-Unis et nous en attendons d'autres. And we are not taking our foot off the gas pedal. We have orders for hundreds of millions of further PPE and other medical supplies, including 500,000 3M N95 masks total for this month, with shipments arriving weekly across the Canada-US border. This is in addition to a larger volume of masks that 3M regularly provides to provincial and territorial health authorities directly. As I will discuss shortly, at the same time, Canadian companies are continuing to ramp up production. Nous présentons des mises à jour hebdomadaires de ces progrès sur notre site web. You will see these numbers of procured PPE fluctuate at times, as orders or contracts may be cancelled or amended in response to global pressures. Given the current environment in which we are operating, this is expected, and it is why we continue to diversify our supply chains and to buy aggressively. Notwithstanding fluctuations, the trend lines are moving in the right directions. At the same time, domestic production continues to increase. My colleague, Minister Baines, and I are ensuring that our domestic capabilities continue to ramp up through our government's plan to mobilize industry to fight COVID-19. Made in Canada face shields, components for testing, and ventilators are starting to arrive, and quantities will increase over time. Companies such as Medicom will be producing N95 and surgical masks right here at home in the next months and years. As the Prime Minister just announced, we have signed a contract for millions of medical gowns with Samuelson out of Montreal, with deliveries starting at the end of the month. This contract is in addition to gowns being produced in Canada by Stanfields, Canada Goose, and Logistic Unicor. Comme la pandémie entame une nouvelle phase, marquée par un déconfinement graduel, nous savons que l'équipement de protection individuelle demeurera en demande. Il est important de maintenir une collaboration active et solide avec les provinces et les territoires et au sein du gouvernement. Nous devrons faire de même quant à notre capacité d'innover et de tirer parti des pratiques éprouvées. Notre conseil sur l'approvisionnement lié à la COVID-19 jouera un rôle important en formulant des conseils sur l'achat des biens et des services essentiels à venir. In closing, demand is going up and we are keeping up. Health workers have enough on which to focus without having to worry about the equipment they use. That is why our government is buying in bulk and has implemented many levels of quality assurance. I want to assure healthcare professionals that they can have confidence in the PPE coming out of federal warehouses to be distributed by provinces and territories. Merci beaucoup. Thank you so much.
Merci beaucoup, chers collègues. Donc, des nouvelles importantes ce matin de la part du Premier ministre. Premièrement, un élargissement important du compte d'urgence pour les entreprises canadiennes, dont 600 000 petites entreprises profitent déjà. Deuxièmement, une mise à jour importante sur l'approvisionnement en matière d'équipement médical. Et troisièmement, l'annonce de 30 jours additionnels de l'entente avec nos voisins américains en matière de frontières communes. Et nous serions maintenant heureux de répondre à vos questions.
Merci, Monsieur le Ministre. Thank you, Minister. So, as usual, we're going to start with 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Operator, over to you.
Thank you. Merci. La prochaine question est de Hélène Buzetti de Le Devoir. La parole est à vous.
Oui, bonjour. Je ne sais pas si l'un d'entre vous sera en mesure de me répondre, mais c'est concernant le Parlement qui continuera ou pas de siéger. Compte tenu qu'on a raté beaucoup de semaines de siège, je me demandais s'il fait partie de vos scénarios envisagés que de siéger cet été.
Merci pour la question et vous l'avez très bien indiqué. Nous sommes dans une situation tout à fait unique, certainement dans l'histoire récente du Canada. Nous avons, comme vous le savez aussi, prioritairement focuser notre attention sur la gestion de la crise sanitaire et économique, mais nous avons aussi besoin de travailler avec les partis d'opposition pour nous assurer de la poursuite de notre agenda plus large, notre agenda gouvernemental, et c'est pour ça que les discussions continuent d'aller de l'avant avec les leaders en chambre des différents partis.
Donc, j'en comprends qu'on n'a pas nécessairement envisagé cette option, contredirez-moi si vous voulez, mais j'aurais une question pour la ministre Anad concernant les ventilateurs. Donc, on semble très prompt à vouloir en acquérir de plus en plus. Pourtant, à ce que je sache, il n'y a aucune province qui indique avoir une pénurie de ventilateurs. À quoi servent-ils ces ventilateurs? A-t-on vraiment en ce moment une demande pour ça?
Merci beaucoup pour la question. C'est important de faire des plans pour le court et le long terme. Nous ne savons pas qu'est-ce qui va passer avec la pandémie COVID-19, donc nous devons mettre en place les plans pour les semaines prochaines et les mois prochains et aussi l'année aussi. Et c'est très important pour avoir l'équipement pour les Canadiens maintenant et dans le futur.
Thank you, Minister. Operator, next question, please.
Thank you. The next question is from Laura Osmond from the Canadian Press. Please go ahead. Your line is now open.
Good morning. For Minister Anand, I wanted to ask you about domestic companies retooling for medical supplies. As the economies are reopening and they want to be getting back to their usual business, how long do you foresee them continuing to make these supplies? And should it be something that we consider in the very long term, having more domestic production of these kinds of things?
It's a very good question. And as I just responded in French, I'll say the similar thing in English, that we don't know how the pandemic is going to affect regions throughout this country in the short and the long term. We also believe that it is important that healthcare frontline professionals have the equipment they need now and in the months and years to come. And so our approach in terms of contracting, both domestically and internationally, is to ensure that we have a steady supply of goods coming into Canada. We've had 34 flights coming in from China recently. But you ask about domestic production, and it is there that it is so incredibly important to focus on, because we want to make sure that Canadians' stores of personal protective equipment and other supplies will be available in the short and the long term. And that's why we have contracts in place to ensure a steady stream of these supplies over the short and the long term. This applies not only to surgical masks, but also to N95 masks. We have a company in Montreal called Medicom that will be producing both types of masks in the coming weeks and months. And in addition, gowns and face shields are also other types of equipment. Hand sanitizer are also very important for us to have these supplies on hand ready to serve Canadians as we move through the next phases of this pandemic.
Follow up, Laura?
Thank you. And for Dr. Tam, I wanted to ask you, what does it tell us, if anything, that 50% of confirmed cases have now recovered?
Yes, so obviously we would want to see the number of active cases, what we call active cases, that those who have not recovered to come down and those who have recovered to go up. And sometimes it can take a bit of time for people to recover as well. And so that's tracked for that purpose. Of course, it's also important for planning purposes, and it indicates whether the health system is still able to cope. So the number of recovered and therefore the number of active cases are important from that respect. But basically, all of the indicators that we're tracking all continue to show that the epidemic, this first wave is slowing down across the country, but at a different pace, of course, depending on where you are.
Thank you, Doctor. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. La prochaine question est de Lina Dib de la Presse canadienne. La parole est à vous.
Oui, bonjour. Dr. Tam, if I can go on with what you just said, you say you see that the epidemic is slowing down, but not at the same pace everywhere. Now that almost everywhere is either reopening right now or planning on reopening in a few days, what data are you going to be looking at specifically? Like, what's the first sign that maybe this is not going well and we should be shutting down again?
So at the Special Advisory Committee, which consists of all the Chief Medical Officers of Health, we've actually put out the criteria for reopening together with some indicators. So one of the first criteria is, of course, that you have control the actual epidemic transmission. And with that, you look at the number of cases, both linked and unlinked to outbreaks. That's important because you want to see if there are any cases that are suggest that there's community transmission, for which further investigation needs to be done. Obviously, testing and contact tracing is very important to support the tracking of these indicators. And you want to see, of course, case counts, but also hospitalizations, ICU rates, and deaths going down. We have been tracking other indicators. Some of them are more useful than others as the epidemic wave progresses. We talked about this effective reproduction number, and that is how many people a specific case would transmit to. For some jurisdictions, this is no longer a very good indicator because they have such low numbers of cases. But for others, we know overall in Canada, that is tracking just below 1. That is one of the ways that we're also tracking this, but depending on where you're at, that indicator may or may not be useful as well. And so we're tracking the disease indicators in conjunction with, of course, indicators showing that hospitals still have capacity to cope. We're tracking, we're sort of making sure that, provinces primarily making sure that people have plans when they're reopening and that workplaces are supported to do reopening safely. So, and also that we continue to keep importation of cases low. So these indicators are already established as part of the foundations for a national approach. Recognizing, though, then there will be regional differences in the timing and how they implement this very cautious reopening.
Okay. Merci. Et Monsieur Duclos, si je peux vous demander, pourquoi est-ce que vous avez senti le besoin d'élargir ce programme de prêt de 40 000 $? Est-ce que vous n'arriviez pas à en distribuer assez, ou il était où le problème? Pourquoi vous avez voulu élargir ça?
Bien, c'est une très bonne question. Deux éléments de réponse rapides. Le premier, c'est que, comme beaucoup d'autres programmes, ce programme a été mis en place rapidement. Il a quand même été mis en place de façon très efficace, puisque, comme je le disais rapidement tout à l'heure, il y a plus de 600 000 petites entreprises qui ont pu accéder rapidement à ce prêt d'urgence. J'aimerais souligner en passant que les petites entreprises au Québec, elles sont extraordinairement importante si on veut relancer l'économie quand la situation sanitaire sera pleinement capable de nous le permettre. Mais la deuxième chose, c'est qu'on s'est aperçu qu'au sein de ces petites entreprises, il y avait une assez grande diversité. Malgré le nombre important de petites entreprises, il y avait encore des petites entreprises qui n'étaient pas capables d'aller chercher ce prêt d'urgence de 40 000 $. Et on est avec le leadership non seulement du gouvernement, mais certainement du leadership du milieu des affaires partout au pays. On a pu trouver une manière d'améliorer l'accès à ces petites entreprises à ce compte d'urgence. Mais l'objectif principal, à nouveau, c'est de s'assurer que nos petites entreprises qui étaient importantes avant la crise et qui vont l'être importantes encore plus après la crise puissent nous permettre de relancer pleinement l'économie. Ce prêt d'urgence fait partie des conditions essentielles. Mais peut-être que Madame la ministre Eng voudrait compléter ce que je viens de dire.
I think that that's absolutely correct. I don't have a lot more to add other than that we have been listening to businesses right from the very beginning. And we've always committed to businesses that we would support them through this very difficult time. And we want to ensure that we are helping our businesses manage and to help them with, the operating costs that they do bear, whether it is utilities or insurance or paying that additional 25% top up, which I know many businesses do. And over 600,000 businesses have already taken advantage of the loan. And it's those expenses that they are using this operating funds for to help them weather through this period.
Thank you, Minister. We'll now turn to the room, starting with Kevin Gallagher from CTV.
My question is for Dr. Tam. Can you let us, give us an idea about what the public health arguments or concerns are for keeping the Canadian-U.S. border closed to non-essential travel? What are the benchmarks that public health officials will be looking at when and if that sort of regular travel between Canada and the United States starts to commence?
Yes, so again, that is quite a broad discussion, but at the Special Advisory Committee, as I said, we looked at some of the criteria for lifting some of the restrictive public health measures. One of the sort of consensus approach at the moment is that we have to cautiously lift measures within our borders first, just to see slowly what actually happens, because we want to see that the cases are still suppressed. You're still going to manage, detect, and clamp down on any new sparks that might come up. That's really, really important. And that depends on public health capacity, healthcare system capacity, protecting the vulnerable, and et cetera. But, part of this equation is if you, the international border and the measures that we've put down at the moment, particularly the massive reduction in the number of international travelers, has allowed Canada to manage this first wave of the pandemic. If there is increased volumes, we want to make sure that we have the safety of Canadians at the top of our minds. So we want to make sure we not only keep up, but maybe strengthen some of those measures. The mandatory 14-day quarantining of people who come in remains a cornerstone as we go forwards. And the fact that we have to be able to manage that and ensure that people are following that requirement, and especially if volumes do go up. So some of these are the key considerations. Of course, there are other considerations by other areas of the government that wants to make sure we still get the supplies and everything that we need. There are social and economic impacts that can impact negatively the health of Canadians as well. So we need to also balance that. But fundamentally, it's about ensuring that whatever we do, the system is still able to detect and still able to cope with any introduction.
And just a follow-up, actually on the World Health Organization, Dr. Tam, we've heard from President Donald Trump that he wants to, threatening to pull American funding from the UN agency, maybe even rescinding the membership of the United States. And it comes at a time, whether you agree with the President's opinion or not, of increased criticism against the World Health Organization for its handling of the outbreak. Is there, are you at all concerned or have any ideas about what the credibility or long-term credibility of the World Health Organization, could look like as this pandemic continues to unfold, as we see that there's pressure for an independent investigation to how the WHO handled the beginning of this coronavirus outbreak?
Well, I think, as everyone can fully appreciate, this is a completely unprecedented pandemic, which in the modern era, people have not seen. So I think every organization will have lessons learned. There is absolutely no doubt. And I think from a Canada perspective, and which I think has been made, clear in many weeks, that one, now is the time for global collaboration, because we just talked about international borders. And Canada cannot resume some of those activities without other countries also collaborating together to reduce the transmission of the virus. So the WHO actually plays a really critical role in that, because every country now has some sort of measure. And there needs to be I think now more than ever, there needs to be international collaboration, and the WHO is critical in that. But I think Canada is also supporting the call for the independent assessment of the response, not just the WHO, which is the secretariat to the World Health Organization, and the Assembly is the member states as well. So you can't sort of just review in just the WHO response, but how we all intersected with it and how each member state is able to respond to it. And so I think that is the prudent thing to go to do. And I think the resolution at the World Health Assembly just now is looking at this independent assessment at an appropriate time. Because right now, of course, everybody is in the middle of response. And this period where countries, not just Canada, many are beginning to lift those measures, is a really delicate time where I think that massive international collaboration has to occur. So I think, Canada supported that resolution, and we will move forwards. I think the other thing is that, I think the WHO is what we member states make it. We can make it stronger and better as part of our international response to future pandemics. But there's no doubt that all of us have something to learn.
Thank you, Doctor. Julie, over to you.
Julie Van Dusen, CBC News. For Minister Anand, in anticipation of a vaccine being developed, I'm wondering, is there anything that you are doing now to get ready, perhaps talking to domestic international companies about making sure that such like a vaccine can be manufactured here? Are you purchasing supplies related to vaccines in advance, syringes and other things?
It's a really good question. Obviously, as I just said, we are preparing for the short and the long term. And the key point in the long-term preparation is to make sure that Canada is positioned well in terms of procuring and manufacturing vaccines. So by all means, we are planning for that. We are ensuring that Canada would have the additional supplies that you mentioned to ensure that we can move forward with vaccinations when the time is right. No question about it.
Okay, and perhaps a little more detail from Dr. Tam about the border. Obviously, there's health concerns. Are they worried about our infection rate, or are we worried about their infection rate, and what has to change for the border to open?
So, as I just said, every country is sort of dependent on all other countries, if you actually think about it. And every country has a role in reducing viral transmission within its own borders. So, of course, we will be watching what is happening in the United States in terms of their epidemic and their trajectory. And as I am certain that they will be looking at the Canadian epidemiology as well. So I think that does form part of the consideration in protecting each other's citizens and sort of collaborating on that. But then looking at, well, how can we then safely resume some of the activities? And as I've said, one of the key aspects of that is that anyone who's entering, if they undergo that quarantine period, you can reduce the potential risk of importation. So all of that, I think, comes into play. But the considerations for that international border is much more complex, I think, than just the sort of technical health input. So I'm sure that leaders will be discussing all those other complex aspects to that.
Thank you, Doctor. Mike?
Hello, Dr. Tam. Mike, I have to ask about President Trump has said on the weekend that he's taking hydrochloroquine, and do you have any thoughts on that?
Well, I think my message is still much the same as what I've said before, which is, we're all wanting to look at viable treatments. Everybody wants an answer and solution. But I think that right now, a lot of the studies are very preliminary on different treatments, and the results have been mixed. However, there's some preliminary evidence from studies outside of Canada suggesting that hydroxychloroquine might have some role or may be effective in reducing some viral load. So our recommendation is that if hydroxychloroquine is being used, it should be part of a clinical trial, for which there are already clinical trials in progress with hydroxychloroquine as arms of those treatment trials. Some of them are essentially being funded by the CIHR and the Canadian treatment for coronavirus, the network that's being supported, feeds into the solidarity trial of the WHO as well. And one arm is on hydroxychloroquine. I think it was just very recently, I can't remember which date, also Health Canada approved a trial for the use of hydroxychloroquine in hospitalized children. And that is very important as well, because different age groups can have different responses to hydroxychloroquine. So really the bottom line is that the medication must, first of all, be preserved for its current indicated medical treatment, for example, for people with lupus, for malaria, prophylaxis or treatment. And then we need to then have hydroxychloroquine go into clinical trials.
Okay. And so we don't have any evidence as of yet that it's having an effect. And more importantly, what are the dangers of taking a drug that has not been fully tested?
Well, I think any drug has side effects, of course. And so that's part of the study in the clinical trials. And some of it might occur, the trials might start with healthy people first, but you want to see how these drugs also perform in people maybe at different age groups, but with underlying medical conditions. And there are drug-drug interactions as well. So I think every treatment has its risk and benefits, and that's why you need those trials.
Thank you, Doctor. We're now going to go back to the phone. Operator.
Thank you. Merci. La prochaine question est de Michel Lamarche, TVA. La parole est à vous.
Oui, bonjour. Une question, soit pour le Dr Tam ou le Dr Njoo. Le premier ministre, ce matin, parlait de lignes directrices nationales en ce qui a trait aux tests et au contact tracing. Est-ce que vous pouvez nous en dire un peu plus? Parce que le déconfinement a commencé dans bien des provinces. Donc, ça va ressembler à quoi? Qu'est-ce que vous voulez voir? Qu'est-ce qui doit se passer?
Merci pour la question. C'est Dr. Njoo. Oui, c'est important. Nous autres, Dr. Tam et moi, on fait partie du jour de la comité un consultatif spécial avec nos homologues des provinces et territoires. On a déjà discuté et décidé c'est quoi les critères pour le déconfinement à travers le pays, parce que c'est sûr que dans chaque région du pays, c'est un peu différent leur propre, comme on dit, courbe épidémique. Et c'est sûr que si les provinces et territoires commencent avec beaucoup de prudence à assouplir leurs mesures de santé publique, il faut avoir une bonne, comme on dit, capacité pour vraiment détecter un bon système de surveillance et aussi pour dépister les possibles cas. Donc, le gouvernement fédéral, on est toujours prêt à supporter avec les ressources les provinces et territoires pour leur approche, pour faire les retraçages de contacts. Parce que si on a une possibilité qu'il y a un autre foyer qui a peut-être été déclaré dans une province du territoire. Et il faut assurer qu'on a la capacité, non seulement pour tester le cas aussi, mais aussi pour faire le retraçage et suivi des contacts. C'est donc, on est toujours prêt, on a des ressources, même de personnel qui sont toujours prêts avec une bonne formation pour aider les provinces et territoires pour leurs approches, pour leur suivi si c'est nécessaire.
Madame Lamarche, en suivi?
Oui, mais c'est pas du tout ça la question. Là. Ce matin, le premier ministre parlait pas des lignes directrices pour le déconfinement, parlait de lignes directrices pour les tests et le retraçage, les contacts des gens infectés. De quoi parle-t-il? Qu'est-ce que c'est que ces directives nationales? Avez-vous un nombre de tests? Avez-vous des façons de faire pour le contact tracing? C'est ça que je comprends pas.
Merci pour la question. Well, concernant le suivi des contacts, ça c'est comme, il n'est pas nécessaire vraiment d'avoir comme une ligne directrice parce que les principes pour le suivi des contacts, c'est déjà très se sont très bien établis. C'est vraiment faire c'est comme dire, faire comme détective, il faut faire des entrevues, il faut vraiment poser les questions au cas, c'est avec qui vous avez eu un contact étroit et aussi faire des entrevues avec les autres contacts. Ça, c'est net et clair. Les lignes directrices pour comme des dépister, c'est quelque chose on a déjà fait. On a discuté avec nos homologues des provinces et territoires. On a décidé, on a, souligné encore les critères pour dépister. Je ne sais pas, c'est presque, fini. Je ne sais pas ce que c'est quelque chose on a publié sur l'Internet, mais en principe, nous autres, les homologues, avec Dr. Tam et moi, on a décidé c'est quoi les critères. Pas donner trop de détails parce que ça peut prendre beaucoup de temps, mais c'est sûr que la priorité, c'est toujours de tester toutes les personnes symptomatiques. On sait que ça s'est évolué parce que au début de la pandémie, même ici au Canada, on a pensé que c'est seulement une liste très courte. C'est seulement quelqu'un avec un toux, peut-être une fièvre, peut-être difficulté à respirer. Mais maintenant, on sait qu'il y a vraiment toute une gamme des symptômes. Donc, avec les lignes directrices, on veut donner comme plus des outils, aussi plus la flexibilité pour les cliniciens, les médecins sur le train, pour avoir un bon jugement, pour dépister n'importe qui se présente avec presque n'importe quel symptôme. Il y a toutes sortes de symptômes. On a déjà une liste très longue. Ça, c'est la première chose. On a aussi parler, discuter avec l'évidence scientifique qui a aussi évolué concernant, les personnes asymptomatiques. Et on dit que c'est sûr qu'il y a peut-être dans quelques contextes, par exemple, si on a un cas dans un établissement de soins de longue durée, c'est peut-être une bonne opportunité aussi pour faire une enquête plus intensive, pour peut-être dépister tout le personnel et aussi les autres résidents dans ce contexte, dans cet établissement de soins de longue durée. C'est ça pour donner quelques détails des lignes directrices. Et moi, je pense que ça va être bientôt, ça va être publié parce qu'on a déjà décidé et c'est fini, mais ça prend du temps, je pense, des fois pour mettre ça sur l'Internet. Mais aussi, peut-être... aussi souligner le point, ça c'est quelque chose, je sais, c'est un peu controverse. On a aussi discuté, et c'est quelque chose pour vraiment bien réfléchir. Qu'est-ce qu'on fait pour dépister comme toute la population, ou peut-être les populations, les sous-populations asymptomatiques. On a déjà parlé des contextes. Si on a peut-être un cas dans un établissement de soins de longue durée, peut-être c'est une bonne opportunité de dépister les autres résidents et personnels. Mais si on prend seulement la population, peut-être toute une région, l'évidence nous indique que c'est peut-être pas la meilleure façon d'utiliser les ressources parce que qu'on augmente toujours le risque d'avoir le plus grand nombre des fausses positives. On peut toujours avoir les fausses négatives. Les résultats des dépistages peut-être ne seront pas si fiables si on continue peut-être à dépister un grand nombre de personnes asymptomatiques. C'est quelque chose, c'est toujours en évolution. C'est quelque chose qu'on discute actuellement avec nos homologues. Merci.
Merci, docteur. Opérateur, prochaine question, s'il vous plaît.
Merci. Thank you. The next question is from Lauren Gardner, Politico. Please go ahead. Your line is now open.
Hi, thanks. This is kind of asked about earlier, but I kind of wanted to pose it to the ministers with respect to reopening the border. Can you elaborate a bit more on what exactly you're going to be looking for, especially from the U.S. side, when you're thinking about things like when can non-essential travel restart? How gradually might a reopening, how gradually might that take place?
Well, if I may start, we'll be focusing on the health and safety of Canadians first and foremost. That's our obligation as a government. Obviously, we'll be relying as well on the advice of public health officials. We have the tremendous advantage in Canada of having public health officials of world class, and therefore they will be helping provide guidance both from an internal public health perspective and from information and intelligence in the South, of course, and that's based on that guidance that we'll be making those sorts of decisions and making those sorts of negotiations with our American friend.
Laura, follow up?
Also, I'm just curious, if cases continue to trend downward, do you foresee a blanket extending through the summer, or do you think that by June there's going to have to be some kind of loosening happening should the COVID trajectory continue to slope downward?
Well, again, these are very important questions. However, they are hypothetical scenarios of which we have very little evidence now. So, as I said briefly earlier, and we would like to say more. Unfortunately, we are very focused on current evidence, epidemiological evidence, both north and south of the frontier, and that's why we were able to come to that agreement with the United States that we would extend the agreement by at least 30 days, and we'll see in the next weeks how we manage the future.
Thank you, Minister. Operator, last question, please.
Thank you. Merci. La question est de Louis-Samuel Perron de la Presse. La parole est à vous.
La question a été posée par des collègues en anglais sur la frontière avec les États-Unis. J'aimerais vous entendre en français, M. Duclos et Dr. Njoo, sur les conditions diplomatiques, politiques et scientifiques pour permettre la réouverture de cette frontière.
Ben, tout d'abord, sur les conditions diplomatiques, nous avons la chance d'avoir une relation qui est solide, qui l'était déjà avant la crise, mais qui continue à l'être. C'est d'ailleurs la raison principale pour laquelle on a pu annoncer ce matin le prolongement de 30 jours de cette entente que nous avons. Sur l'évidence scientifique, nous avons aussi la chance de pouvoir compter sur des experts en matière de santé publique qui sont très solides et qui sont même reconnus à l'international. Et c'est sur la base de leurs avis et sur la base de ces bonnes relations que nous avons avec les Américains que nous allons continuer à discuter avec eux pour trouver la bonne façon d'atteindre notre plus important objectif qui est celui d'assurer la santé et la sécurité des Canadiens. Et au fur et à mesure que cette santé et cette sécurité des Canadiens vont être assurées, nous allons pouvoir continuer à voir de quelle manière le commerce important que nous avons entre les deux pays va pouvoir aussi, lui, continuer à être soutenu.
Louis-Samuel, en suivi?
Oui, sur un autre thème, les transporteurs aériens comme Air Canada refusent de rembourser les billets d'avion à des dizaines de milliers de Canadiens. Est-ce que votre gouvernement va obliger les transporteurs à rembourser leurs clients avant de leur offrir toute aide publique?
Bon, sur la question des remboursements de frais aériens, on le sait et on le sent à quel point c'est difficile et même frustrant pour les Canadiens qui ont réservé un billet, qui ont payé pour ce billet, de ne pas se le voir rembourser. Ceci étant dit, nous sommes dans des conditions extraordinaires et ces conditions extraordinaires ont un impact significatif aussi sur les compagnies aériennes. Et donc, on compte sur les compagnies aériennes pour faire ce qu'elles peuvent dans le respect des règlements et de la loi pour traiter correctement leurs clients, puisque les compagnies aériennes ont aussi besoin d'entretenir de bonnes relations avec leurs clients si elles veulent un jour redémarrer. Ceci étant dit, nous avons des programmes d'aide importants pour les petites et les plus grosses entreprises, la subvention salariale qui s'applique par exemple à toutes les entreprises, le programme pour aider les grands employeurs qui a été annoncé la semaine dernière, qui s'applique particulièrement aux grandes entreprises comme Air Canada, que l'on espère que ces grandes entreprises vont pouvoir utiliser pour pouvoir, comme je le disais, à la fois maintenir le plus possible leurs opérations, mais traiter le plus correctement leurs clients.
Merci, Monsieur le Ministre. Ceci met fin à la conférence de presse d'aujourd'hui. Thank you.